Now we are going to see indications for do an early diabetes mellitus screen during gestation. So this is if we have a pregnant woman with obesity, so with a body mass index greater than 30 kilograms per cubic meter before she got pregnant, plus one of the following. So if the patient has more than 40 years old, or if the patient had gestational diabetes on a previous pregnancy, or if the patient has a macrosomic baby. This is a baby with weight greater than 4 kilograms. Or if the patient has an ovulatory cycles like polycystic ovary syndrome, or family history of gestational diabetes. So indications to do an early screen of gestational diabetes is body mass index greater than 30 plus one of either of these ones. And this is, we need to do the universal screen we do in the third trimester, but this would be done in the first trimester. So first, when we have a pregnant woman coming to the initial visit, we ask, is the patient a high risk patient for having gestational diabetes? So meaning, is a patient with body mass index greater than 30 and one of the following? If the answer is no, so she has no high risk. Oh, if the answer is no, then we do the screen test during the third trimester, as we saw in the previous video. But if she is a patient with high risk of developing gestational diabetes, then we do the screen test. We do the universal screen test in the first trimester. So remember, the universal screen test is we take an oral glucose load of 50 grams. If this can be without fasting, we measure the blood glucose 1 hour later, and if blood glucose is greater than 140, then this is abnormal. If this is abnormal, then we go to 3-hour test, and the patient is going to fast for a night. So after fasting, then she will receive a 100-gram oral load of glucose, and we are going to measure blood glucose 1 hour after the oral load, 2 hours after the oral load, and 3 hours after the load. If fasting blood glucose is greater than 95, that is abnormal. This is abnormal. If it's greater than 1 hour, greater than 180, this is abnormal. If it's greater than 155, then this is abnormal after 2 hours. And if after 1 hour is greater than 140, then this is is the criteria, the Carpenter-Cautain criteria. But the criteria for the National Diabetes Data Group is like 10 grams per deciliter higher than this. So fasting blood glucose criteria with the NDDG is greater than 105. Blood glucose 1 hour after the 100 gram load test abnormal is greater than 190. 2 hours after the load abnormal is 165, and 3 hours abnormal is 145. These are abnormal values with the NDDG, or in the Carpenter criteria, these are the abnormal values. So it's the same screen test, just if the patient has is a patient with high risk of diabetes mellitus, then we do the screen early. We do it in the first trimester. If after doing the universal screen test, the test is abnormal, then she will be diagnosed with gestational diabetes if we have more than 2 or more abnormal values, or impaired glucose metabolism if we have one abnormal value. But if the test is negative, I mean we did the screen test in the first trimester, and if the test result is negative, so it's normal, then we do again the screen test in the third trimester. And is the same. We already know how to manage this. This is the same. If the patient is diagnosed with gestational diabetes, then during the postpartum, she will have to be evaluated for diabetes mellitus after the pregnancy with 2 hour screen test, which is 75 gram oral glucose load, and the glucose will be measured 2 hours